One question that I frequently get from clinicians is, what do I need to do to become a DBT therapist? And really, the answer to that is going to depend on what your plans are and where you work. Partly because really anybody right now can call themselves a DBT therapist. There's really no regulatory body looking at, looking at the people that call themselves DBT therapists. Now, there is the Linehan Institute, which is now looking at certifying clinicians as DBT therapists. Unfortunately, many of us wouldn't actually even be able to get certified, though, through the Linehan Institute. So I have actually written 7 books on DBT, and I wouldn't be able to get certified as a DBT therapist. And the reason for that is because I do not work as part of a DBT program. So the work that I do, of course, is about bringing DBT to disorders other than borderline personality disorder. And so really I use DBT every single day with every client that I work with, regardless of their diagnosis. And I really make DBT specific to the client that I'm working with. And by the way, I use DBT skills myself, which is really important in terms of building our own area of expertise in that regard. But back to my question about being a DBT therapist, I think it's really important that we make sure that we educate clients when they are contacting us for DBT therapy, because a lot of clients, of course, don't exactly know what they're asking for with DBT. DBT is a full treatment model, right? It's that full program. So when I have somebody who calls me to say, my psychiatrist, for example, has told me that I need DBT, it's important for me to educate them on what DBT actually is and on what it is that I can provide. So DBT as a model is not just individual psychotherapy. It's being in skills training group once a week. It's having access to 24-hour, 7 days a week telephone coaching with a DBT therapist. And it's the DBT therapist having a DBT consultation team that they meet with once a week. So that is what DBT actually is. So when I have somebody call me and ask for DBT, what I can provide is DBT-informed therapy, or I might say that I provide DBT skills training and individual work. So it really just, again, depends on the kind of work that you're doing, how you're going to present that to the client, but making sure that you're educating them about what you can and can't provide. So again, back to the original question around who can call themselves, or what do you need to do to call yourself a DBT therapist. It really depends just on your level of comfort in what you're providing. Educating yourself around DBT, obviously attending workshops, which are fairly limited in our area. So we're fortunate that, for example, Leading Edge and other service providers are bringing these kinds of workshops and training opportunities to us. Do as much reading as you can, practice the skills yourself. Again, this is a really important way of building your expertise in the area. And another helpful thing that I found is like forming teams with your colleagues. So I've actually formed kind of a mini consultation team with some private practice colleagues of mine in the area. And we get together for lunch every 1 to 2 months, and it turns into a little bit of a social, but a little bit of like a clinician support group. And so we're building our skills that way. So do whatever you can to make sure that you're building your skill level. Can you call yourself a DBT therapist? Most of us actually can't. We're more DBT-informed therapists, and make sure that you provide all of that information to your clients so that they're making a really fully informed decision. That's my best advice.